and welcome to Alchemy TV, our brand new platform bringing you all the best video content from Alchemy Arts. Alchemy TV will continue to showcase stories that matter to our community both locally and further afield. Now, so much has changed over the last 8 months, and with that in mind, we felt it was really important to develop something that was new, innovative, fresh, and reflected the times we are living in. More and more engagement online is inevitable, and yes, this is the new normal. With COVID-19 still classified as a global pandemic, staying safe and knowing its signs and symptoms is more important now than ever before. And I'm really excited to be working in partnership with Salford Public Health and the local NHS to bring you episode 1 of our TEK Eagles Salford COVID special. This episode features information about COVID-19 and interviews with members of the community and experts, outlining how to stay safe, the issues surrounding the virus, and the return to normal life.
The lockdown was actually announced on the 23rd of March, and straight away I thought to myself, my wife was in Birmingham, how do I get there, etc, etc. But luckily, our community and our mosque, we were already aware of this lockdown which is going to be happening, so mentally we were already prepared.
Alors, la première fois quand j'ai entendu parler du confinement, j'étais au travail. Et voilà, j'étais en train de travailler, je ne savais pas trop quoi faire. Mais immédiatement, je me suis mise en confinement, moi et mes enfants, pour respecter les directives du gouvernement.
So when the national lockdown was brought in, it helped us at the time of most need because it meant that we were able to break transmission just there and then, and it was extremely helpful. But where was I at that time? I was unwell and I was working from home because I didn't want to take the virus into the work settings.
I remember I was at work and I just, because I actually every now and then I work from home, so it was okay, but the uncertainty of how long will that be for, and certain aspects and tasks at work that I don't know how I'll do it without meeting people, or it was a bit difficult. It was a strange circumstances for us, but I always believe that we're gonna work it out.
D'accord, donc depuis le confinement, donc je suis restée à la maison, je ne suis pas sortie. J'ai suivi les directives du gouvernement. Je me suis lavé les mains parce qu'on demandait de se laver les mains. Je ne sortais que pour aller faire des courses.
I have stayed indoors quite a lot, and moved stuff online. So lots of online Zoom, Skype, Teams meeting. But also when I have to go out, I make sure that I have my face mask.
I just stayed at home, and I felt it is a civic responsibility that it's not just I'm saving myself and my family, I'm saving everyone else as well. And by doing that, not so many people would go and exhaust the NHS and for it to collapse.
We actually closed all our ablution areas. We sealed all the bookshelves and all the shoe racks, and we put our signs around the entrance, on the actual prayer hall, even on the wall to remind people. And we actually made a one-way system. So we enter through one way and you go out another way. The exit is another way. And we stand 2 meters apart. No shoe racks, so you have your own shoe bags to actually put your shoes in, and you have to put them next to you. You bring your own prayer mats, wear a mask. You have to register your name, your address and everything, and you give them a roll number. So after whenever you come for another prayer, you just say your roll number and then you get ticked. Every day this list is updated. Every day you have to come in, say your roll number, hand sanitize, and then you come in.
Oui, enfin, je pense que les informations parviennent aux communautés noires, aux groupes ethniques noirs ou asiatiques, mais je pense qu'il y a également un problème de langue. Donc, il y a des gens qui parlent le français dont la première langue, par exemple, c'est le français, le portugais ou d'autres langues africaines qui ne comprennent pas nécessairement très bien l'anglais. Donc, je pense qu'il devrait y avoir plus d'efforts dans ce sens pour faire parvenir des bonnes informations à ces communautés.
Normally, we would have a meeting where, a few members, we would have a meeting and we would discuss, these are the guidelines that the government has given. How would we address it to the community in simplistic format? And we would actually put it in few bullet points that this is what the government has said and we have to follow these instructions in English, in Arabic, in Urdu, and in the Bangla language as well. So 4 languages, and we would distribute them on WhatsApp, or we would leave them in the shop or on emails, and everyone would get it. So everyone, whoever doesn't understand the English language and they're from the Yemeni community or the Pakistani community or the Bangladeshi community, they would understand.
What some of us have been advocating for is culturally tailored, appropriate messaging, but also to work with BAME leaders, pushing out those messaging and all the healthcare professionals, right across the NHS. Some of them should have been, encouraged and asked to convey some of those messaging.
Public health is about the public. It does not. It doesn't see gender. It doesn't see faith. It doesn't see language. It doesn't see any of them elements that differentiate people from each other. And that is a strong message we want to give to everybody. It's all about equality. It is called public health. It's for everybody.
We've been working with places of worship and with different faith leaders across faiths, and so we've been putting those messages out. We already had good relationships because public health organised the personal protective equipment distribution where it's most needed. So we'd already made sure that they had sufficient supplies of face coverings, for example, for their festivals. We were working with Muslims on Ramadan before, and we're working with our Orthodox Jewish community in particular to make sure that they're protected, because ethnic groups and faith groups are the higher risk for having the virus transmit within them, and that's why we were really clear that we needed to work with our faith and ethnic minority communities to make sure they know how to protect themselves and how to protect each other.
I think we need to reflect on our actions and to activate, as I said, the personal responsibility button in every one of us. Because and I know from the community there is resistance. People don't want to wear masks without or face covering without a reason. If you medically cannot do it, that's understandable. But if people don't do it, they need to know that they're harming others as well as they're harming themselves.
The message is that we don't know that people can't get it twice. We don't know how long immunity lasts. And the virus just doesn't end with you. It moves on to the next person. It moves on to your circle of friends and family, and you don't know where they take it. And it would get to their elders. It would get to people who have a heart disease or diabetic or have high blood pressure or really old, really vulnerable. And it could affect them seriously. And so you've unwittingly passed it on.
Oui, il y a effectivement des inquiétudes dans ces communautés parce que beaucoup de ces personnes ont peur de rentrer travailler vu que les gens de ces communautés, dans les communautés noires, dans notre communauté par exemple, beaucoup de gens ont été affectés, beaucoup de gens ont perdu leur vie. Donc il y a la peur, il y a l'anxiété, les gens n'ont pas le courage de sortir et aller travailler. Ils ont peur pour leur vie en fait.
Sometimes, in the media, we get, we have a thumbs down that we are backwards or we're not doing too much in the actual, whilst living in the 21st century in this Britain. But we are actually trying to do everything what the government has said, or what the government has said. For example, in Ramadan, like I said, we had to adapt do these kind of hard changes. People come to the mosque every time in Ramadan, but we had to stay at home. People opened their fast in Ramadan in the mosque, but we had to open the fast at home. People had to read their night prayers and listen to the Quran, but we had to do that at home. So many people couldn't finish the Quran at home because they can't read as fluent, and they try to normally learn in the mosque. They didn't have that opportunity. But then once lockdown was eased, the day before Eid, it was lockdown again. It was a semi-lockdown. And people did not go around saying, this is ridiculous. Simple, after the Eid prayers, people were in their homes. So we are actually abiding by the rules. And we are trying to all work together and respect whatever the government and the Prime Minister has said. And so as a Muslim, as an Imam of the mosque, and seeing it from, my own community, I think we are playing a big role in respecting and in integrating with other communities.
People think it's gone. And this is a scary one, because it hasn't gone. It's around us, it's affecting people, and it's killing people.
I think people feel that it won't affect me, and therefore if it's not going to affect me, then I need not bother or restrict my activities in some way. Whether it's people who think they had it before, that it won't come again, or people who think I'm young and it won't harm me, and actually I'd much rather get it over with.
Because there are people who actually died, thousands and thousands of people who died, and if we actually don't give attention to this and respect, and we think that it's not true, then people need to reflect on what and how they think.
This is a pandemic, so we've come to know so much more than it just being a fever or a cough or loss of taste and smell. Those are the main symptoms for true, but we have seen people with other symptoms like just a headache, people who are off their food, older people who just suddenly become unwell and they don't have a fever but actually feel very cold. So lots of symptoms could be coronavirus. That's why in Salford and in some other areas as well in Greater Manchester, we're saying if you're unwell for any reason, you're not your usual self, book a test because it may be coronavirus.
I believe the best way to prevent myths is to give a very clear message.
So our first key message is protect yourself and protect everyone, and that's the social distancing. Everybody's really familiar now by what we mean by social distancing, and it still is 2 meters because the virus hasn't changed its transmission. It still can transmit within 2 meters as opposed to within 1 meter. So social distancing, 2 meters as far as possible. Wear face coverings in the places that you're supposed to, but also wear face coverings sensibly, and always wash your hands and respiratory hygiene.
I think I would advise myself as well, to stay active to the best of my ability and to read, maybe start new hobbies, and try to think before you believe. When someone tells you something, think about it. If people are dying, COVID exists.
We're going to be living with coronavirus for a long time, 12 to 18 months, I keep saying. If it's shorter, then I'm quite happy I'll be pleased along with everyone else. But realistically, we have to plan that we're going to be living with coronavirus for some time.
I hope life after COVID is better than before. I don't think we were very happy. It wasn't good old days. It wasn't. Before COVID, we had our problems, a lot of problems anyway. It's just an opportunity to reflect and make things better at all levels, all aspects of life, I think.
So hopefully this episode has provided you with some useful information about COVID-19, its signs and symptoms, and how to stay safe. To get the latest information regarding COVID-19, or if you have any other questions, please visit nhs.uk/coronavirus or gov.uk/coronavirus. And if you are worried that you may have symptoms, regardless of your travel for contact history, call 119. I look forward to you joining us in our next episode. Until then, stay safe, control the virus, and you will save lives.